And hello everybody, myself Dr. Martina. I am senior consultant physiotherapist in Sanjeevani Hospital, Bilaspur, and working as a pelvic floor rehab therapist also. And I've done my MPT in ortho. So today, and really thankful to Dr. Pradyut sir. Thank you sir for selecting me as a resource person for this topic. I will be very grateful to you and will always connected to you for helping MMA Movement Master Academy for helping all the students all over India to gain some knowledge related to any topic. So today my topic is related to muscles, pelvic floor muscles, their function and dysfunction. So one of the most muscle that is being kept unignored means we always ignore that muscle, and they are the some other way very important muscles that kept under talk. We never talk about that muscle, but the muscle, they are the group of muscles, means not a single muscles, but they are a group of muscles that help to support, that helps in supporting the pelvic organ in sexual activity also they are involved. Sphincteric action they are involved, in stability they are involved, and in lymphatic also they are involved. So looking and moving forward with pelvic floor muscles, they are the group of muscles, and mostly they are in a hammock shaped muscles, or in dome shape, or in diamond shape. When we look, they are the group of muscles, not just a single muscle. They are in a group of muscles. So many muscles are there. Together they are called as pelvic floor muscles. They are placed in the pelvic region. The pelvic region is a region. This region is the pelvic region. Okay. This pelvic region consists of two innominate bone. Okay. These are the two innominate bones. On the posteriorly we are having the sacrum, and at last we are having the coccyx. This is the pelvic region, and the muscles that are found here in this region, in the pelvic region, are called as pelvic floor muscle. Okay, so the two innominate bone consist of the ilium, okay, the ischium and the pubic in the front, with sacrum and coccyx posteriorly. So pelvic floor muscle is situated in the pelvic region. Group of muscles, diamond in shaped, okay, or dome shaped, or hammock shaped muscles. They are group of muscles that are placed here in the pelvic region. Now they extend from the base of the spine to the pubic bone. This is the base of the spine, and from here they are extending forward up to the pubic bone. Okay, and these pelvic floor muscles are interconnected and work together as a unit, and collectively help with tightening and loosening vagina, urine control, supporting pelvic organ, and to enhance the intimate health. These pelvic floor muscles, the muscles don't have any bony support. Look, we don't have any bony support here down. This is only the muscles that are working against gravity. They are working continuously against gravity. That is by having two types of muscles fiber, the slow twitch muscle fibers and the fast twitch muscle fiber. Type 1 slow twitch muscle fibers, and the fast type 2 white muscles fiber. Because pelvic floor muscles continuously hold the pelvic organ, so we require the slow twitch muscle fibers. Okay, they are mostly the endurance based muscle fibers. And the fast twitch muscle fibers, they have to work for quick sphincteric action during increased abdominal pressure, such as during sneezing, coughing, laughing, sitting, etc., and all during when the our in abdominal pressures get increased. They have to prepare quick sphincteric action to hold urine in the urethra, so that the urine leakage should be prevented. Okay, these pelvic floor muscles, this region, Okay, holds three organs. The three organs are placed here in this pelvic region. They are the urinary bladder. Just for demo, this is the urinary bladder. This is the uterus and the vagina, urinary bladder and the urethra looply, uterus and the vagina, and rectum. Okay, these three, all three organ are placed like this in the pelvic floor muscles like this. Okay, so like this, you are getting it. These are the three organs that are placed above the pelvic floor muscles. So this is the urinary bladder. Anteriorly is the urinary bladder. Just behind the pubic symphysis. Symphysis pubic के just पीछे में हमारा urinary bladder है and urethra. Okay, urinary bladder. Posterior to the urinary bladder is vagina. Okay, uterus is not placed posterior to urinary bladder. It is posterior superior. You see the position of the uterus, it is posterior superiorly. Okay, it is just because of this position during pregnancy, due to the increasing weight of the fetus, it continuously put pressure on the urinary bladder. That is why we are having number of time we feel urge of getting urinated. Okay, then posterior to the vagina we are having this rectum and this is anus. Okay, is it clear? This is urinary bladder just behind the pubic symphysis. When we are moving anterior to posterior, anteriorly we are having urinary bladder, urethra. Just behind the urinary bladder posteriorly is the vagina and posterior superiorly is our uterus, and just behind this is rectum and this is anus. Okay, these three organ are the pelvic organ. Okay, these three organ are the pelvic organ and they are supported by the pelvic floor muscles. This is the pelvic floor muscle. Okay, anteriorly is the pubic symphysis and posteriorly is the coccyx bone. Okay, when to understand the boundaries of the pelvic region, okay, the pelvic muscle, see, we have to know about the boundaries of anteriorly. What we are having pubic symphysis here, okay, anteriorly, and then pubic ramus. Okay, this is the pubic ramus. Okay, here on the both side we are having sacrotuberous ligament, and on the posteriorly we are having coccyx. See, this is a pubic symphysis anteriorly. This is pubic ramus. From here, we are having sacrotuberous ligament. Okay, sacrotuberous ligament, and on the posteriorly we are having coccyx and sacrum. Okay, so anteriorly it is also the pelvic floor muscles running anteriorly and moving down posteriorly, and somehow it is coming the lateral wall also. Lateral wall, anterior and posterior. So it look like a hammock, just like this, or dome shape or bobble shape. In this shape, the muscles are placed, dome shape, and in this dome shape muscles, all three organ rest. Okay, like this. Okay. So when we talk about pelvic floor muscles is divided into three layers. Okay, superficial layer, middle layer, and the deep layer. Superficial to deep, when we move, this is a superficial layer, then middle layer, and the deep layer. This is the superficial layer. This is the superficial layer. Okay, and then middle layer. Okay, and then most deepest deep layer, deep layer, middle layer, and superficial layer. So we are talking about the all three layers of pelvic floor muscles. When we talk about the layers of pelvic floor muscles, just look here. Okay, this is the pelvic floor muscles. The region, you can note here the boundaries. Anteriorly, it is having the pubic symphysis or symphysis pubic. This is the ischiopubic ramus. Okay, on the both side, ischiopubic ramus. We are having sacrotuberous ligament over here, sacrotuberous ligament, and on the posteriorly we are having coccyx. Okay, we are having coccyx. When we look down, we are looking here for the three openings. Okay, in the female, we have got three openings. The first opening here is the urethral opening. Okay, then coming posteriorly is the vaginal opening, and then the last we are having anal opening. In female, we are having three openings: urethral opening, vaginal opening, and anal opening. But this vaginal opening is absent on male. Male, we are not having this opening. Okay, so this is the most superficial layer when we look. Okay, on superficial layer we are having this muscles that is running close to ischiopubic ramus. Okay, this one is the ischiocavernosus muscle. On superficial, this ischiocavernosus muscle. And the big round one, the bulb shaped muscle is the bulbospongiosus muscle or bulbocavernosus muscles. Okay, and this particularly line transverse superior transverse perineal muscle. This one is the superior transverse perineal muscles. As it is running transversely, it is superficially, it is transverse in pattern, and it is superficially on the perineum. It is a superficial transverse perineum, and this is the external anal sphincter. And in between the vagina and the anus, we are having this perineal body in the center. Okay, you are getting it? We are having perineal body in the center. From anterior to posteriorly, when we see on the superficial layer, what we are having, we are seeing ischiocavernosus muscle, then the bulbospongiosus muscle, superficial transverse perineal muscle, the external anal sphincter, these are superficial muscles. Okay, and the function of these muscles, mostly they are helpful in sexual arousal. These muscles, what happened is ischiocavernosus muscles and the bulbocavernosus muscles pump blood towards the clitoris. Okay, to make it erectile, pumping the blood toward the clitoris for sexual arousal. Okay. Then comes the second layer. This is the second layer. The first layer, we are having two triangles. Okay, we are having two triangle. The front triangle is called as urogenital triangle, and the posterior triangle, see, it is looking in a diamond shape. Okay, you are seeing it is looking in diamond shape. The muscles are looking in diamond shape, and these muscles are, wait, see here, you can see the two triangles. Okay, the blue color triangle muscle is looking into diamond shape, and the blue color triangle is a urogenital triangle, and the yellow color small triangle is the anal triangle. So on the superficial layer is divided into two triangles, urogenital triangle and anal triangle. Okay, is it clear? These two triangles. Okay, superficial layer is divided mostly known as urogenital triangle. Then moving further into the deep layer, when we go into the deep layer, we are seeing external urethral sphincter. This is the external urethral sphincter, and this is the deep transverse perineal muscles running deeply. Okay, and this both together, external urethral sphincters along with deep perineal muscles together called urogenital diaphragm. And it mostly covered the anterior triangle part. Okay, not present posteriorly, this present on anterior side. Okay, when we see the this white color, this is sacrotuberous ligament. Okay, this muscles is pubococcygeus muscle. This is iliococcygeus muscles. Last one is the coccygeus muscles. It is gluteus medius. This is the middle layer. Middle layer mostly help in functioning of maintaining continence. Okay, it is helping maintaining continence because it is having urethral sphincters, external urethral sphincters, ureterovaginal sphincters, compressor urethrae, and deep transverse perineal muscles. Understood? Once more. Okay. The middle layer consists of urogenital diaphragm. The urogenital diaphragm is made up of external urethral sphincters and the deep transverse perineal muscles. Okay, and these muscles that are present here mostly work in functioning as helping in sphincteric control. Okay, they do quick sphincteric control. Then on the last, we are having the most deepest muscles. This is the most wider area. Mostly it covers the whole of the pelvic region, and these muscles are wider and broad and provide maximum support to the organ that are present. Maximum supports to the organ, the uterus, the vagina, and the uterus, urinary bladder, the uterus, the vagina, urethra, and the rectum. Okay, here the muscles that are present, both muscles, the pelvic floor muscle require both the slow and the fast twitch fibers to work here. Okay, that is why the pelvic floor muscles are made up of slow and fast twitch fibers. Okay, because it requires a combination of both the slow and the fast twitch fiber for helping the muscles to contract also and to support also. Okay, here the pelvic diaphragm is of female is formed by levator and eye muscles. Okay, the main muscle is the levator and eye muscles. This levator and eye muscles provide in or assist maximally in supporting the pelvic organ. Okay, the levator and eye muscle here. Okay, this is the levator and eye muscles. It starts from the pubic symphysis and end here. Okay, so the first muscle of elevator and eye is the pubococcygeus muscle. This muscle. This is the pubococcygeus muscle. Okay. This pubococcygeus muscle starts from pubic symphysis and in the coccyx. Okay, pubococcygeus muscles. These pubococcygeus muscles give three extensions. Here one the uretral opening, the pubourethralis on vagina. On vagina, it gives pubovaginalis, and on last it gives to rectal opening to puborectalis. Okay, it gives three extension, first, second, and third. First to the pubourethralis, then pubovaginalis, and pubo. Last one is the rectum. So puborectalis muscles. So the main component of the levator and eye muscles are pubococcygeus muscles, In that pubococcygeus muscles, we are having pubococcygeus, puborectalis muscles, and iliococcygeus muscle. Okay, got it? The muscles. Here the main levator and eye muscles, what you are looking here, the levator and eye muscles form the largest component of the pelvic floor. They are the largest, making the largest component of the pelvic floor muscles, and they get innervated by the pudendal nerve. The pudendal nerve S2 and S4, they supply the levator and eye muscles. This levator and eye muscles, when you are seeing, is divided into the pubococcygeus muscle. This pubococcygeus, the front muscles, control urine flow and contracts during orgasm. Okay, for male, in female it helps in controlling the urine flow and contracting during orgasm. For male it assists in ejaculation, and for female it aids in childbirth and core stability. So when the terms come for core stability and for assistant in female childbirth, during childbirth time also, and during core stability, this pubococcygeus muscles help so much, and it also helps in maintaining the urine continence and proper positioning of the baby head at the childbirth. Okay, this pubococcygeus muscles. Moving to the puborectalis muscles, when you're seeing the puborectalis muscles, this is U-shaped sling type of muscles, and it is mostly its contraction bends the anal canal and create an anorectal angle that is 90-degree where the rectum meets the anus here, where the rectum meets the anus, they make anorectal angle like this angle of 90-degree. Okay, this 90-degree has been formed by this puborectalis muscles, and this puborectalis muscles is the thick muscles. Its main function is to maintain continence, and this muscles during defecation, when we defecate, it relax to relax and become straight or straighten the anal canal to allow passage of the feces, to allow the passage of the faces. Okay, when we compare the superficial and the deep layer, see on the superficial layer, we are having ischiocavernosus muscles, bulbocavernosus muscles, superficial transverse perineal muscles, external anal sphincter. Okay, but this on the deep muscles, we are having urethral opening, external urethral sphincter, the deep transverse perineal muscles together making the urogenital diaphragm. On superficial it is urogenital triangle, and just on middle layer it is forming the urogenital diaphragm. And then moving more deep, we are having the pubococcygeus muscles, puborectalis muscles, iliococcygeus muscles. Okay, now iliococcygeus muscle. These muscles, the iliococcygeus muscles which you are looking here, okay, this is the pubococcygeus muscle and this is the iliococcygeus muscle. These muscles act as the elevator of the pelvic floor muscles and the anorectal angle. This is the elevator. And these muscles during the second phase of the labor, the levator and eye muscles, and during the second stage when we are looking this levator and eye muscles, the pubococcygeus, iliococcygeus muscles, puborectalis muscles are more prone to damage. Okay, they are more prone to damage. See the nerve supply of this pelvic region, pelvic floor muscles. They are mainly supplied by the pudendal nerve. Okay, we are having a rich nerve supply and blood supply near the opening for the quick sphincteric control. Okay, for the quick sphincteric control. Is it clear? So for the quick sphincteric action, we need type 2 white fast twitch fibers because they are very rich in blood supply, quick reacting because large capillary bloods work faster. sustain contraction over time, and fatigues quickly. So what the contraction they are doing is 10 to 20 times per second. The contraction they are doing is 10 to 20 times per second. Okay, the type 1 fibers that are present that are red in color, they are the slow twitch fibers, and type 2 are the white color fibers, they are the fast twitch fibers. Because both these fibers are rich in blood supply, so quick reaction is been required, so they get quickly fatigued. So for the fast twitch fibers, the contraction is 10 to 20 times per second, and for the slow twitch fibers, it is a 30 to 60 times per second contraction. But the tone here the muscle tone is affected by the age and the trauma. है ना? And during the childbirth, lifting activity, obesity, hormone changes, abdominal surgery, in during this time, what happened? The tone of these muscles get affected. See, the female pudendal nerve, the nerve that is supplying S2 to S4. So when coming to the functions of the pelvic floor muscles, okay, the main function of the pelvic floor muscle is supportive, as these muscles support the three organ placed above it, the urinary bladder, the uterus, vagina, and the rectum. Okay. Then second is the stability factor, help in stabilization. Third is the sphincteric action. Fourth is the sexual action. And fifth is the lymphatic action. First is supportive action. Second is stabilization action. Third is sphincteric action. Fourth is sexual. And fifth is lymphatic action. So how these muscles are helping? So how these muscles are helping in supportive? So these muscles are holding all these three organs. This muscle, this is the muscle, deepest muscle, and all this organ, okay, anterior to posteriorly, are being supported by these muscles. Okay, they are holding it. So that is why they are providing support to the organs. And how it's acting for the stability. When we talk about the stability, okay, we have to see that the stability factor, the pelvic floor muscles is one of the component of the core, our core system. Our core system is sometime like that. Superiorly we are having our diaphragm. Okay, superiorly we are having diaphragm. Lower we are having pelvic floor. On the top we are having diaphragm. Lower we are floor is being made by pelvic floor muscles. Anteriorly we are having abdominal muscles, the transverse abdominis muscles, and on the posteriorly we are having multifidus muscles. Okay, this all four components make up the core. See, when we look, it is a ball shaped or balloon shaped. When you look, this ball, when you look on, the top part is diaphragm, making the roof. ये छत बना रहा है. The diaphragm is making the roof. The pelvic floor is making the floor. Anteriorly is the abdominal, transverse abdominis muscles and anterior abdominal muscles. And on the posterior, we are having the multifidus muscles. So our pelvic floor muscles make up the floor component of the core system. So if our floor is weak, what will happen? Okay, if our floor will be whatever, everything that is being placed above the floor will drop down. This is the floor and this is the organ placed over here. When these floor muscles are strong enough, the organ that are placed above it will be on the proper position, getting maximum support. With the weakness of this floor, what happens? If the floor will be weak, all the muscles will drop down. Okay, so pelvic floor muscle is one of the component of the core and it's making the floor components. So some other way, if the pelvic floor will be weak, our lumbar stability will be affected. That is why in most of the cases with weak pelvic floor muscles or with tight pelvic floor muscles, we are having back pain due to decrease in the lumbar stability. Our lumbar stability is getting affected. Okay. So here the first function was to support all the organ. Second was the stability, as the pelvic floor muscles is one of the component of the core, acting as a floor of pelvic floor core component. If the weak pelvic floor muscles will be there, then some other way the stability of the lumbar spine will be affected, because the diaphragm above and the pelvic floor on the down, roof and the floor are working in synchronicity. They are acting as a piston movement. Okay, this movement is being done. Okay, ये एक सिंक्रोनाइज पैटर्न में ये वर्क करते हैं. ठीक है. अगर कोई ना कोई कंपोनेंट यहाँ पेल्विक फ्लोर का अफेक्ट हो गया, ऊपर डायफ्राम में मूवमेंट हो रहा है और पेल्विक फ्लोर मसल्स उसके साथ सिंक्रोनिसिटी में वर्क नहीं कर रही है, पिस्टन पैटर्न नहीं कर रही है, तो इंटरनल एब्नॉर्मल प्रेशर बढ़ने के कारण कहीं ना कहीं हम इंजर्ड कर लेंगे. इंटरनल एब्नॉर्मल प्रेशर बढ़ जाएगा और डायरेक्ट प्रेशर कहाँ पर आ जाएगा, पेल्विक फ्लोर मसल्स में, और पेल्विक फ्लोर मसल्स के ऊपर जो ऑर्गन है उसमें डायरेक्ट प्रेशर पड़ेगा और वहाँ की जो ऑर्गन है हो सकता है प्रोलैप्स हो सके. So, to maintain the stability, pelvic floor muscle is very much needed to be strengthened. Then third is the sphincteric action. Okay, quick sphincteric action during increased abdominal pressure or whenever we used to urinate. हमको जब भी लग रहा है बाथरूम जाना है, we need to urinate or we need to pass the stool. This sphincteric action is needing, means the opening of the canal is needing, the relaxation of these canals are needing. Okay, external sphincters are needing. This has been provided by the pelvic floor muscles. And though our superficial layer of the pelvic floor muscles are involved in sexual arousal, so some other way, our sexual life is also affected if our pelvic floor muscle will not be okay. Then last is the lymphatic drainage. As these muscles are present on the lower part of the body, they have to pump the blood against gravity up to the heart. So they are providing quick pumping action also. They are providing quick lymphatic drainage also, so that that is why they are having a rich blood supply over this perineal or pelvic floor region area. Okay. So here is the function of the pelvic floor muscle. Understood? Supportive function, stabilization function, sphincteric function, sexual function, and lymphatic function. Moving toward the pelvic floor dysfunction. If any of these components, supportive function, stabilization function, sphincteric function, sexual function, or lymphatic function will be disturbed, then the muscles is said to be in dysfunction. Okay. See the stability and the mobility factor here. Stability is the contracting ability of the pelvic floor muscles. Mobility is the relaxing activity of the muscles. The two both contraction and relaxation has to be equal. When the both factor contraction and relaxation of the muscles are in balance, the muscles is in maximum strength, or we can say most effective. When the stability factor increases, okay, when the stability factor increases means the tone, the muscles contraction capacity is increased and mobility factors decrease down, means the muscles is not able to relax. And when the mobility factor increase means the muscles are in a relaxed position, not able to contract. So in these two condition only we determined as dysfunction of the pelvic floor muscle. See, with the toned pelvic floor muscle, with the droopy pelvic floor muscles, and with taut pelvic floor muscles. See, toned pelvic floor muscles, maximum tone in means the stability and the mobility factor of the pelvic floor muscles is tone equal, बराबर है दोनों. ड्रूपी पेल्विक फ्लोर मसल्स कब हो जाएगा, जब मोबिलिटी फैक्टर ज़्यादा हो जाएगा, मसल्स बहुत ज़्यादा रिलैक्स्ड हो गई है और कॉन्ट्रैक्ट नहीं कर पा रही है, तो हमारी मसल्स ड्रूपी यानी ड्रूपी पेल्विक फ्लोर मसल्स आएगा, यानी वीक पेल्विक फ्लोर मसल्स, मतलब मोबिलिटी फैक्टर यहाँ पर इंक्रीज हो गया. टॉटेड पेल्विक फ्लोर मसल्स, टॉटेड पेल्विक फ्लोर मसल्स तब होगा जब हमारा स्टेबिलिटी फैक्टर्स बहुत ज़्यादा हो जाएगा, मसल्स बहुत ज़्यादा कॉन्ट्रैक्टेड है, इज नॉट एबल टू रिलैक्स एट ऑल, देन वी से इट इज टॉटेड पेल्विक फ्लोर मसल्स. See how the muscles get dysfunction. Aging, with proper age, the tone of the muscles get